Hello, I'm Dr. John Butler of Hypnotherapy Training International. I'd like to tell you about two courses we have coming up soon, and these are in March 2020. Now, all of our courses are built on roughly 30 years of teaching, so we know very much what a practicing hypnotherapist needs to learn in their foundation training to deal with the kind of issues they'll be dealing with and to be effective in dealing with those problems that people bring. These two courses are Hypnotherapy Skills for Life Change and Clinical Hypnotherapy. So they run one right after the other. Now, the first one, Hypnotherapy Skills for Life Change, introduces you to a great range of techniques, principles of hypnosis, of key areas, which are primarily the phenomenon and the power of suggestion, the phenomena and power associated with waking hypnosis and those associated with trance hypnosis. A good hypnotherapist needs to be able to introduce a person into a trance in less than a minute, as Dave Ellman would say. And you learn how to get people into a measurable level of trance and apply the necessary suggestibility tests so they know they've been relaxing well and achieving a level of hypnosis and responsiveness, which they can build and develop on from there. As you learn on that course, you learn how to apply hypnosis in clinical applications for smoking, various weight management problems, to deal with performance enhancement, stress management, and so on. So you learn how to become, in many ways, an effective hypnotherapist with many of the problems you learn to deal with, even at a more advanced level, but you'll be learning how to take on additional problems as well. But you'll be getting better and better with all of the problems that you're confronted with. And so our job is to teach you to become the very best therapist that you possibly can become. Now, on that course, you're going to learn clinical skills as well. You have to learn about verbal and non-verbal communications, learning about language, the use of the voice, learning about self-hypnosis so that you can put yourself into a trance, because that determines very much how well you can work with other people's subconscious mind. So it's very experiential, very hands-on, a lot of professional supervised attention, with the most of which I give you myself, and we have some other experienced people who are there to help you as well during your practice sessions. The clinical hypnotherapy course builds on that first course and extends it, both in the depth of knowledge that you will have about hypnosis and self-hypnosis and programming and how to work with visualization, imagination, and so on. And you learn how to develop the uncovering skills you need for analytical hypnotherapy. The old-fashioned name for that was hypnoanalysis. So you learn how to go deep into the mind, the inner workings of the mind, to uncover the roots of the negative behaviors that people are afflicted with, negative mental or physical behaviors. These include the negative fixed ideas and the associated emotions, which generate such an amount of suffering, self-sabotage for people, and which cannot realistically be healed by purely intellectual therapy. Talking about it for years in therapy can make you feel a bit better about it, perhaps generate some progress, but also often leaves the person still not able to deal with the deeper conflicts of the mind, which are deeply at a subconscious level. So when you've learned clinical hypnotherapy, you are able to penetrate deep into the mind, to the roots of these problems, so you can revisit that early maladaptive learning, begin to change the programming, and bring in all kinds of new integrations, and also beginning to bring closure at a very deep level to the past, so you can properly live in the present and get on with a very full and successful living. Now, as a therapist, you'll learn those applications for working with people. You'll also learn to work on yourself as a therapist. And our courses, as I've just said earlier, are very experiential. So on each course, you'll be practicing the very methods that you're being taught, so you can then become effective the moment you go out working with people, and you'll know how to continue to progress in your professional development and become an exceptional therapist. I'm looking forward to seeing you in one of our courses in the near future, and thank you very much for listening and watching.